This is probably going to go against everything you've ever heard about osteoarthritis. Most people think osteoarthritis is just wear and tear, that the joint is damaged, stiff, and nothing can be done. But here's the truth. There's one factor that almost nobody talks about, and it has more impact on your osteoarthritis symptoms than the arthritis itself. And I'll reveal exactly what that is later in this video. But first, let me introduce myself. I'm Dr. Rob, and I'm a sports chiropractor. I've worked with sprinters, rugby players, crossfitters, you name it, I would have worked with someone in that field of sport. But I've seen firsthand that the same principles that keep my athletes competing at the top of their game also help my patients with arthritis stay mobile and pain-free. But before we dive into that, I want to hear from you. Where do you feel your stiffness the most? Do you feel it more in your knees, hips, hands, neck, back, or somewhere else? Drop it in the comments, and here's the important bit. Don't just leave your answer, scroll through and reply to at least one person who has the same issues as you. When you realize you're not the only one, that other people are going through the same things as you, it's easier to stay motivated and take back control of your body. And by the way, this is the start of my arthritis series. In the very next video, we'll talk about how your muscles and posture play into your arthritis symptoms. And I'll show you a simple test that you can do at home with no equipment to see if your muscles are actually protecting your joints or making them work harder. So hit like, subscribe, and turn on the bell so you don't miss my next episode. But this is part one, osteoarthritis and what factors really drive it. And here's the thing about arthritis. It doesn't affect everybody in the same way. I've seen patients with quite advanced arthritis on their x-rays or their scans who hardly feel a thing, and others with only very mild changes to their joints, but they feel stiff and sore every single day. And the research out there backs this up. It shows that scans and x-rays, they don't always match how much pain the patient feels. And this is why treatment isn't just about what the scan shows, it's about how you move and how you feel. So what does that tell us? Well, it tells us that arthritic changes in the joints aren't the only factor to what you're feeling. There's something else that decides how stiff or how sore you feel. To understand that, we need to think about our joints like a car engine. As we age, yes, we make a little bit less synovial fluid, and that's the equivalent of oil in a car engine. And that's the reason that sometimes in the morning, we can feel like our joints are a little bit more stiff or a little bit more rusty. But the bigger problem is lack of use. If you leave a car sitting in a garage for too long, the oil will settle, the engine will seize. But if you drive it regularly, the oil keeps circulating and the engine runs more smoothly, which makes the car last longer. Your joints work in exactly the same way. Movement circulates the fluid, and if you stop moving, they'll stiffen up. And here's the bit most people don't realize. The cartilage in your joint, that smooth surface on the ends of the bones, it doesn't actually have its own blood supply. So how does it stay healthy? How does it get fed? Through movement. You have to move to allow your cartilage to get the nutrients it really needs. Every time you move, you load and unload the joint. And that makes the cartilage act a bit like a sponge, pressing the fluid out and then pulling fresh fluid back in. And that fluid contains all the nutrients it needs. So that's why after sitting for an hour, your knees or hips feel really stiff. The sponge hasn't been squeezed. And then when you finally stand up and walk, that stiffness will ease out. That's not wear and tear repairing, it's the joint fluid circulating. And this is why athletes take warming up so seriously. People think it's just about loosening of muscles and getting things moving, but it's also about getting that joint fluid moving. And that's why the first few minutes of activity can often feel stiff and tight, and then smoother once that fluid has started circulating again. So your stiffness and your pain is not just about the arthritis in your joint. It's about how much or how little you move that joint. Remember at the start of the video, I said there's something that matters more than the arthritis itself? Well, that was it right there. It's movement. And this isn't just my opinion. Every major guideline, from NICE to the international reviews, say the first treatment for osteoarthritis shouldn't be medication, shouldn't be surgery, it should be exercise. Because movement doesn't just help you feel better, it is literally protecting your joint. That's why I can see patients with osteoarthritis who stay active and stay mobile, and their pains and their stiffness get better over time. And then others with the exact same level of arthritis, the same diagnosis, who just get stiffer and stiffer because they don't want to move. The difference isn't the arthritis, it's the movement. It's the amount of effort they put into keeping their bodies active and mobile. So if you can take just one thing from this, osteoarthritis doesn't mean it's game over for you. Movement really is medicine for your joints. The old saying, use it or lose it, could not be more appropriate here. So in the next video, we're going to dive into how your muscles and your posture affect arthritis. And I'll show you that test I mentioned earlier. The one that tells you if your muscles are protecting your joints or they're putting more strain on them. So make sure you're subscribed because you won't want to miss it. And before you go, don't forget today's question. Where do you feel your stiffness the most? In your knees, hips, hands, or somewhere else? Drop it in the comments and reply to someone else too. It really helps us all see that we're in this together. If I'm going to answer, it's my hands, and I know that's work related. It's what I use all day long. I'm Dr. Rob, and remember, I've got your back. Literally. See you next time.